And do the nurses and the doctors talk together in the morning before, make a plan for the day? Are the nurses set up in different areas? How does that work?
Absolutely. So at our place, again, different from others, but we have what we call a stand-up, and we all get together as a team in the room and we go through who's here in the day, what's happening, and who's got what spaces and how we can help and support each other. And then we go to our look at our own schedules and appointments, and doctors and nurses, what we call huddles, we huddle together and we'll be aligned during the week as to different huddles of different clinicians. And that might be a doctor and nurse, it might be a HIP or health improvement practitioner as well in the room. And we go through the patients of the day, and we look at them and we thought, what's happening with them, what's happening with their whānau, how can we support them? Maybe we need to plan some care for them. It might mean that they need an acute plan if they have lots of admissions to hospital, and we think, oh gosh, what can we do to help them so they can manage their care and so prevent those hospital admissions? Or maybe they're getting towards end of life and it might be an advanced care plan, those sorts of things as well. Or you might spy on their recalls that they need a smear or behind vaccinations. Hey, look at that and get them in before they come in and align them with the docs at the same time. It works really well. It's
I bet
nice.
it does.
Yeah. Or, that's when you can think, they might benefit from seeing a health coach or a health improvement practitioner, or we have a social worker. So, it's about thinking around that holistic view of what that person or that whānau might need before they come in.
Is there any professional development that goes on with the nurses, or are they just learning as they go?
So we have a mix, again, depending on what you are in terms of nurse practitioners, done that masters and further training, or the prescribing postgraduate. You're a registered nurse, you've done your 3 years, and yes, in general practice we're generalists and we know a lot about a lot, and there are modules that we have. You can do online training. There are lots of face-to-face, maybe with your PHO, that there's training to go in. There's small group training. And I think that as we evolve in our model of care is that we are now upskilling a lot in our scope. And so, for example, we now have healthcare assistants who are doing administrative tasks that we may have done in the past. So we can have more face-to-face with our patients, and we're skilled for that. And a lot of nurses will go on and do look at areas that they're really passionate about, and so you've got passionate people in front of you educating you and have those skills because they've done the training, and it's really great. You've got I've got clinicians that are really happy in their practice, and then you've got happy patients because they've got really skilled people they're going to see.
And if I was to see a doctor for a certain condition, and there was another doctor that was their special interest, is it likely that the doctor that I've seen will go and have a chat with them at a later date and they make a plan based on that?
Absolutely. Whether that's a skin check, whether it's some sexual consult or some other service, absolutely, that works really well within our team.
So when I come to the nurse, I'm due a vaccine, and I'm not doing too well. I'd love to talk to somebody. Can I talk to the nurse about that? Is that something you offer, or are you just, no, we're vaccines and bandages, that's it?
Absolutely. I think it's really important that people, when they come in to see us, you might come in for a wound or vaccination, but it's not just about that. It's around what's happening with you in your life, and so it's a time for you to talk, and we can listen to you. Often we nurses have that time, a little bit more time, and we can hear and listen and think, what's happening, and would you like some help with that? What kind of help would you like? And maybe that might be that we give you some online information, some courses, some websites to go to that are great websites to look at. Or we might want to, if you want to see the doctor or a health improvement practitioner, health coach, the podiatrist, the social worker, and so it's around our team, meeting your needs. So yes, sometimes it's like, oh gosh, we've got to do this, and I hear there's a lot going on for you. Come back and see me, and or the appropriate person. Sometimes it's, you're unable to deal with everything at that time, but just to hear and to understand, then we can go from there.